Start by showing my environment. So before I begin, I just want to verbalize that I would perform my hand hygiene prior to entering my patient's room. And do I have your permission to film you?
Yes.
Okay, so I'm going to get started with my assessment of the skin, hair, and nails. Hand hygiene. Hi, my name is Becky. I'm going to be your student nurse today, and I'm going to be performing a skin, hair, and nails assessment. So first I'm going to start with inspection of the skin. When I inspect the skin, I'm going to note that my patient has a fair to medium tone to her skin. There doesn't appear to be any areas of hyperpigmentation or hypopigmentation. I'm going to assess for any scars, any lesions, any bruising, tattoos, piercings, and I note none of these. If I had come across a lesion, I would perform an ABCDE assessment. A being asymmetry, B assessing the border if it's regular or irregular, color, making sure that the color of the lesion is uniform throughout, D being diameter, I would ensure that the diameter is less than 3 millimeters, and for E, I would be assessing for elevation of the lesion. So now I'm going to begin my palpation of the skin. I'm first going to palpate for any moisture of the skin of the upper and lower extremities, which I don't know. So now I'm going to go ahead and palpate for temperature, texture, and make sure there's no areas of extra thickness. So her temperature is warm in her upper extremities and warm in her lower extremities. The texture is smooth on both her upper and her lower extremities bilaterally. And to assess for any areas of extra thickness, I would look at areas that are often worn, which is like the soles of her feet and her elbows. There is a little extra thickness on the soles of her feet, but this is considered normal. So I'm now going to assess the skin turgor of my patient above her clavicle. So I would pinch the skin up right here, and it returns briskly to the surface of her skin. If her skin had tented, this would be a sign of dehydration in those who are not among the elderly population. So now I'm going to move on to hair. I'm going to inspect the color, which is uniform throughout. I'm going to inspect the distribution, and I'm going to assess for any infestations, such as lice, and I'm also going to assess her scalp, make sure that there aren't any lesions there. Next, I'm going to assess the nail beds of her fingernails and of her toenails. So I'm going to start by doing that with capillary refill. So the normal capillary refill is less than 3 seconds, which is present in both her fingernails and her toenails. I'm also going to assess her nails for the nail bed color, which should be pink, and it is, which is also present in her toes. And I'm going to assess the contour of the nail bed by having her put her thumbs together. So can I have you just put your thumbs together like this for me? Perfect. And when I look through, I should see a triangle. This is an indication that the contour of her nail beds is normal. If there was not a triangle, this can be an indication of clubbing, which could indicate that she is not getting adequate circulation to all of her extremities. But this concludes my skin, hair, and nails assessment.